So just starting out, I have to do this in all my presentations, just given the line of work. So just in terms of disclosures, not getting paid for anything today. I'm not connected with any pharmaceutical companies or receiving any sort of financial compensation for anything related to that. Like it said in my introduction, I do have a couple different hats that I wear within the mental health field. So first and foremost, my full-time job, I'm a clinical psychologist by training, and I do oversee Natchaug Hospital out in Mansfield, Connecticut. Under the Hartford Healthcare Behavioral Health Network umbrella, we provide mental health and substance use resources at pretty much every level of care you can think of. So in the prevention realm, and then also in the treatment realm, we offer individual, residential, a lot of different types of group therapy, inpatient therapy, rehab services, you name it, we have it. We're all across the state of Connecticut. So while the focus today is thinking a bit in the prevention realm and what we can do to prevent things from getting to the point of needing treatment, we also want to make sure that if you get to the point that that is needed, you know where to go to get that and what options you have available to you. And certainly Natchaug Hospital where I work, any of our treatment services across the state, as well as a number of other agencies are available for that when it's needed. We'll talk more about that at the end too, of how to connect with them if that is what's required. The other hat that I wear is within that prevention network. So you have the treatment side of where you go to get the help when it's needed. But we know that before folks get to that treatment side, it's important to talk about prevention. Connection is a huge component of prevention work because the more that we feel connected to our society, to our community, to our friends and our family, and to ourselves, there's a lot of health benefits of that can sometimes prevent things from getting to the point of requiring treatment, whether that's physical medical treatment or emotional psychiatric treatment. So I do get the opportunity to work in both of those realms, which is a real treat for me because it means I get to work with folks across that whole sector that I mentioned. So thinking about mental health, we throw the term out a lot. There's a lot of different ways that people describe mental health. Sometimes it's called behavioral health, sometimes it's called psychiatric treatment. But what we're really talking about when we say mental health is our overall mental well-being, how we're feeling from day to day, what sorts of thoughts we're having. There's a huge connection between how we feel physically and how we feel emotionally or mentally. So that mind-body connection is a really critical part, especially as we begin to age. Because if our physical body is starting to deteriorate and not feeling well, and our emotional is doing the same, we're kind of fighting an uphill battle. So if there's ways that we can right-size one, where we can really put some additional energy into making sure that our mental health is well, a lot of times that can really help support our physical health also remaining well, or if we're going through an illness, can help with that healing process. A lot of research out there has shown that when our mental health is well, we get the help and support in that realm, it actually decreases the time that it takes to physically heal from an injury, an illness, etc. It can also help reduce the impacts of chronic illnesses that may never fully go away, but reduces the risk of flare-ups, for example. So really critical that we think about that connection and how those things may play out in your day-to-day life. The other thing that's important to note in mental health in general is that there's a lot of what we call stigma around mental health. It's a really hard thing for people to talk about. That's starting to get a little bit easier as folks have become more accepting that, again, we all have mental health. Everybody struggles from time to time, but that hasn't always been the case. So part of the importance of doing talks like this, even if it's not at all relevant to you as somebody who has maybe struggled, learning how you can have these conversations, what words to use, how to ask the question to somebody that you might be worried about can be a really integral way in supporting somebody who may be struggling. We know that a lot of folks who are struggling with mental illness or just not feeling well emotionally will keep those feelings and thoughts to themselves. And that can really cause those feelings to fester and worsen without anybody recognizing it. So the more that we can give ourselves permission to talk about those things and make sure that we've got the space to ask for that help when it's needed or provide that help when it's needed, the better it is for everybody who might be struggling and providing them the best opportunity to improve and feel better. So what the data tells us, like I mentioned at the start, I'm a psychologist, I love data, I love numbers, research, it's my whole background. So it's important that we talk a little bit about the numbers. Recognizing that, again, mental health is something we all experience. It does also mean that there's times that gets to the point of meeting the criteria for a diagnosis for a mental illness. So the research shows us that 1 in 5 Americans will qualify for a mental illness at some point in their life based on the symptoms that they're experiencing. It's a high number. So just sitting here, there's 4, I make 5. 1 of 5 of us, 1 out of risk group, potentially could qualify for a mental illness and meet the criteria for that diagnosis. Now, granted, there's many different diagnoses out there. There's not, just a handful. There's a whole book of different options of what that could be. But even just holding that number in your mind is a critical thing to recognize, that this is not a rarity for people to experience these things. Recognizing that can be important, because we want to understand that this is not something that I'm going through alone. Again, we're talking a lot about isolation and loneliness today. If I feel like I'm the only one who feels like this, nobody else understands me, I'm probably not going to share the way that I'm feeling with many people, because it's going to make me feel really vulnerable to share something that I don't think other people are going to understand. So if I know there's others out there that are like me, that this isn't unique, that I'm broken, it's a problem with me, makes it a little easier to seek out that connection and talk through what I'm dealing with. So then when we start to think about the older population as we're aging, unfortunately there are some factors that create a little bit more risk for us, and we'll talk about some of what those are. But almost 15% of individuals over the age of 50 are experiencing symptoms of a mental illness. So maybe not meeting the full criteria for one, but experiencing symptoms. So when we say symptoms, there's a lot of different things that can be in that list, but things like isolation, low mood, low energy, difficulty sleeping, sleeping too much, using substances like alcohol or other substances that we may have access to. Those are all symptoms of a potential mental illness. The most common mental illnesses that we see in the older population tend to be anxiety and depression. So those symptoms could be things like avoiding stressful situations, feeling really on edge, again, having low energy, having a hard time getting up in the morning, sleeping too much throughout the day, not doing the things that used to bring us a lot of joy, kind of avoiding those things, avoiding other people, that social isolation. I just don't have the energy to go out and face all those people today. I think I'm just gonna stay home. We tend to see the symptoms of those increase over time as folks are getting older, also based on a lot of social factors, and we'll talk about that too. 2/3 of older adults experiencing mental illness do not access treatment. This is a really critical thing. So again, like I mentioned, there's a lot of stigma when it comes to mental health. Unfortunately, within older populations, that amount of stigma tends to be a bit higher, just based on cultural norms. What I mean by that is that if you go back through generations, every generation has slightly different ways of thinking, different cultures. How we're raised really influences how we think. And so, for example, if you were raised in a family where you didn't talk about your problems, everything stays at home, we don't share what's going on for us, you're gonna kind of stick with that mentality over time, because that's how you were raised, that's your belief system. And so then it can be really hard to shift that mindset to, I'm gonna openly talk about why I'm struggling, why I'm having a hard time, because that thought's always gonna be in the back of my head of, when I was a kid, I was told to not do that. Or I have to maybe connect with a different type of person. So like, I'm a psychologist. I hear a lot from some people that really lean into their faith, which is a huge protective factor. We love that. But I shouldn't go talk to a therapist. I have to go talk to my priest. The priest can be a fantastic resource and a great protective factor for that person, but they're not a treatment provider. So there might be some limits of what they can and can't do. And their partnership with a clinician, for example, could be really helpful. But if they're not accessing formal treatment where it's needed, that can be really risky. So part of, again, doing this prevention work, having these sorts of conversations, is to also educate people who are in other sectors, for example, like houses of faith, like a Catholic church or Protestant church or Jewish, whatever it may be, knowing how you can be an ally to that person if they come in and they're talking to you about their struggles. And also, if you feel like maybe you're starting to get out of your depth in what you're able to do for them, knowing what resources are available for you to connect them with. So that you can say, hey, I'm here for you. I would love to stay as support for you. And I wonder if we could pull in this other person too. We're gonna create a network for you with the people who can be here to support you. It can be a really great way to connect with additional people, build that network, and get that person the help they need from a number of different angles. And as I mentioned earlier, anxiety and depression are the two most common mental illnesses that we tend to see in the older adult population. We'll talk a little bit more about why. So those risk factors that I mentioned earlier, there's a number of them across the age span. So I chose this picture because I think it's important to recognize that there's risk factors at every age. The risk factors may just start to look a little bit different depending on what part of your life you're in. So when we think about physical and health-related factors in general, risk factors for an older population, thinking about some of the changes that happen, the physical process of aging, your body changes, You have to slow down. Maybe you're dealing with a specific diagnosis or illness that's impacting how you're feeling from day to day. Like I started out mentioning, there's a big connection between your mind and your body. If you get up every day and you're immediately in pain and it takes you a little bit longer to get moving, and you're a little bit slower and it's harder to stand up, doing all of those things can start to wear you down emotionally. It's really hard to accept that our bodies are changing. So that can have a big impact on our mental health when we start to notice that those changes are happening, and different people approach aging differently. Some are very comfortable with it. For others, it's really scary. For others, maybe it's just really challenging to accept that you're moving into a different stage of life. So those things are all important to think about. Like I mentioned, chronic illness is a big one. So for some folks, you have a certain diagnosis, you go through a course of treatment, the illness goes away, you're cured. It may have been hard to get to that point, but you get there. Other types of illnesses are chronic, they're lifelong, they're not as easily remedied. That can also take a toll on us emotionally when we know, again, that the whole course of our life may have to be altered slightly by whatever that diagnosis is. It can be really hard to sit with that. And then lastly, medications. So medications are a necessity for many for a number of different reasons, but medications can also have an impact on us. They treat something, but they may also have side effects. And those side effects can also have an impact on us. So for example, ones we hear a lot about in my realm, weight loss, weight gain, energy levels, feeling really groggy, tired, having a hard time waking up in the morning, not feeling that their minds are quite as sharp as they once were. So those are all impacts that can influence the way that we're feeling. The other thing that's important to note is that some medications are safer to take than others. And so when we think also in the substance use realm, for example, folks who have a chronic illness, if there's pain associated with that, you may get put on a medication regimen to help manage that pain. And it's so important that those medications are monitored and taken as prescribed and appropriately under the supervision of a doctor, because if we start to misuse those because we're trying to just manage our pain, that can be a really high-risk situation that could potentially turn into addiction. When we think about the opioid epidemic, for example, we tend to kind of visualize a certain type of person in our mind just based on our own belief systems, biases, etc. But for some folks, they start to think of, the younger kids, the ones who are getting involved in other sorts of drugs. But actually, one of the highest risk populations for an opioid addiction is the elderly population, because those medications were initially used as a prescription to manage pain. So we have to think about the risk in that realm too. That I'm talking mostly about mental health today, but substance use is also a really big component of that. Another really commonly seen substance in the elderly population is alcohol use. It's been around for a long time. It's usually fairly socially acceptable in a lot of different climates, but that misuse can happen when we start to use it as a coping skill for managing other things. I'm really stressed. I can't wait to get home at the end of the day and have a drink just to take that edge off a little bit. Having that drink before I go to bed really helps me sleep a little bit better. And then that turns into 2 or 3, or now I have to get up in the morning and the first thing I do is take a drink, because that's kind of what gets my day started, because I get a little shaky if I don't do that. Warning signs that the substance use may be getting worse at that point. So just in recognition that medications are incredibly important and following them by a provider, but there is also some risk in them. So making sure you're having those conversations, talking about the side effects and their impact on you with the doctors. There's a lot of different ways that those side effects can get managed. So giving that feedback can be really helpful in making sure that it's getting managed appropriately. So now thinking about the social and life factors. So we kind of talked through some of the physical aspects of our body. So now the other side of that, life transitions. Touched on this one a little bit earlier. So when you think about as you're going through life, you're hitting different stages. So, the kids go off to school for the first time, then they graduate and they go on to college, and then they get their first job, and then they get married and they buy their house and they have their kids. So we're going through all these different life stages. And again, there's different risk factors at different points in that process. Now, as we continue through that life stage, our kids have grown up, they've moved out of our house, different things happen at that point. Maybe you're starting to think about retirement. You get into retirement, now you're not working. You've been working for 40 years. Now what? What do I do with that time now? Some people are really great at filling it, other ones get kind of lost in that process. Trying to adjust to a new normal. Empty nesters, for the folks who have their kids move out, take some time to adjust to that new normal. Those things can be really fun for some people and getting to explore a new stage of life, but it can also feel like a grieving process sometimes. There's some loss that goes along with that. Finding different purposes in different parts of our life can be really stressful, and so that is a risk factor that we want to be mindful of. That gets into the next one that I have listed, so that sense of purpose. That shifts throughout life. We have a lot of different identities. So like I mentioned, I wear 2 hats just in my professional world, but I'm also a mom, I'm also a wife, I also have other hobbies that I like to do. So those are all different things that give me a sense of purpose. But they change over time. And I'm putting different amounts of energies into different ones at different points in my life. So we need to take an inventory of what those things are that give us that sense of purpose. And if we're starting to notice that that list is dwindling a little bit, it might be time to explore that. What else could I do that could give me that sense of joy and energy again? Because those things are really important to that sense of connection for ourselves. Doesn't even involve other humans necessarily, but just that sense of connection and purpose internally for me can be a really great motivator for my own health and wellness. Social circles is another big one. Those also change throughout our lives. Friends come and go, family comes and goes, colleagues, etc. Social circles change a lot in a lot of different ways as we get older as well. So I'll use the retirement example. Maybe you've been working with the same people for 20 years. You see them every single day until you retire, and then you don't, and you stay connected, but that connection's gonna look a little bit different. And that's a key theme of what I wanna really highlight here, is that even with all these changes happening, that constant underneath is the connection can still be there. It might just look a little different. So you don't see those people at work every day, but you still connect on the weekends to go out for lunch to connect. You are, going and spending time with your adult children or your grandkids now that, you don't have kids living in your home anymore. Different things like that that still get that sense of purpose there, that you can connect with that identity, but that sense of connection with people might just look a little bit different. Finances can be another big one. It's a big source of concern, so we'll stick with the theme of retirement. Your finances change. Maybe you're getting put on a fixed income. You need different access to resources or entitlements. A sense of security is really critical at any point in our life. It makes us feel safe. Financial security is a big component of that, and when that feels jeopardized, that can really be risky in terms of how we're feeling, in terms of a sense of safety, stability, and our stress levels. And then lastly, caregiver stressor. So this is not an all-encompassing list, but being a caregiver for somebody. We're caregivers at different points in our life. If you've had kids, you're a caregiver at that aspect. Maybe you've got family members who need support. So there's 2 aspects of this and why I felt it was important to put on here. You may turn into a caregiver for another loved one who's also aging, and there's a lot that can come with that in terms of making sure you're taking care of them and also taking care of yourself. But on the other side of that is you may end up at some point being the one who requires somebody else to have that caregiver role. And there's a lot that comes into play with that too. So being able to accept that help is critical. But there can be a lot of feelings of guilt and shame that comes with that too, that you don't want to be negatively impacting that other person, you don't want to be a burden, all those sorts of feelings and thoughts that can come into our head that can really negatively impact us, where that sense of connection, feeling accepted and loved by people, and having open conversations with them about those stress levels can be really helpful, both for you and them in navigating those situations. So like I said, this is certainly not an exhaustive list. Everybody has different unique risk factors or things that maybe impact them a little bit differently, but it's important to take inventory of what they are. So the role in isolation of all of this, so this is really the point of this conversation today, is the isolation aspect. So social isolation and loneliness are the 2 key concepts here. They can sometimes get used interchangeably, but there are some important differences. So social isolation is the lack of social relationships or an infrequency of social contact. So the presence of relationships, social contact, the presence of other people. Loneliness is a subjective feeling of isolation. I can be in a room full of people and I can still feel really lonely if that connection isn't there. Or I can feel really connected to other people and not have that loneliness at all. Or I could have social isolation where I'm really not around people all the time, but I don't have that sense of loneliness because I'm okay having a little bit less social connectedness to people. Everybody's got different needs. However, we all had a really big dose of social isolation back in 2020. If anybody remembers what happened then, we went through this weird pandemic situation and we had to do social distancing and we couldn't be near anybody. That was a really, really critical time for a lot of people in sense of that feelings of loneliness, and social isolation had a skyrocketing effect on people. It was a big impact for many, and unfortunately, specifically in the aging population, became even more challenging when they became identified as a high-risk population for contracting COVID. The impact was there. So now you're adding fear on top of that. That had a significant emotional impact on many, many, many people. So we learned a lot through that. To the point that in 2023, the US Surgeon General, Dr. Vivek Murthy, we'll talk more about him, identified loneliness as a national epidemic. So COVID was an epidemic, significant impact on us. The Surgeon General identified loneliness deserved that same title, an epidemic of sort that caused such a level of impact on people it was worth highlighting at that caliber. It just goes to show the importance of that. Then in 2024, the American Psychiatric Association, or the APA, did a Health Minds poll monthly and identified that 30% of American adults felt lonely at least weekly over the past year. 10% reported loneliness every single day. Those are really high numbers. So that was 4 years after the start of the pandemic, so it wasn't over. Still not sure it's 100% over. But it was pretty far out from the biggest impact of it, and the sense of loneliness is still there at a pretty critical level for a lot of people. So we want to really identify, like I said at the start of this, that older adults are at a heightened risk for both isolation and loneliness. So when we start to think back to some of those risk factors and what aspects go into that risk, think about those life changes. You were once employed somewhere, you had kids at home, you were surrounded by people all the time. Lots of connections happening naturally through those different components in your life. Your kids have moved out, you've retired, now you're just home, maybe you're still living with a spouse, maybe you're not, maybe you've experienced a loss. So just through daily life, a lot of those connections have a risk of cutting back. So that's where we want to now be mindful of how do we still create that connection in a really meaningful way so that that isolation doesn't happen and lead to an onset of an increase in loneliness. So as we think about that, and I'm a big digester of all things podcasts and reading, I'm a huge reader. And there's this woman, her name is Brene Brown. Has anybody heard of her before? Okay. She's fantastic. So she's a social worker and a teacher by training, turned into a kind of global phenomena in the world of belongingness, courage, leadership, vulnerability. She had some really great talks on those. But she started this podcast during COVID. Actually, she started a few of them. It's called Unlocking Us. And she met with a lot of different people to talk about all sorts of different concepts, but she did meet with that US Surgeon General, Vivek Murthy, to talk about the book that he published called Together. And that whole book was focused on the healing power of human connection in a sometimes lonely world. So really thinking about that concept of loneliness. And I pulled a specific quote because I found it really meaningful here, so I'll just read it to you. There's this deep stigma around loneliness, the shame that comes with loneliness and makes us think that if we are lonely, then we're not likable, that we're broken in some way. And that prevents us not just from admitting it to other people, but even from admitting it to ourselves. And I think the second reason, though we don't always see it, is because it doesn't look like the person at a party sitting alone in the corner. Loneliness, in fact, can manifest in a number of different ways as social withdrawal. It can manifest as anger, it can manifest as irritability, it can show up in different ways, and it can also lead to different types of illnesses. So this is where we start to really recognize that, again, loneliness, just like a lot of other mental health conditions and feelings, can negatively impact our physical health as well. And it's not that image that you described of somebody sitting in the corner at a party not talking to anybody, maybe sometimes. But again, you can be in a room full of people, and if you don't feel connected, it doesn't matter how many people are in that room. You can still get that feeling. It can start to lead to a lot of that negative self-talk of nobody wants to be around me, I am a burden, I'm not likable. I shouldn't really bother going out to that thing because nobody's going to talk to me anyway. So that's when those feelings can start to worsen, those thoughts can get more negative, and it could start to lead to symptoms of a more significant mental illness. So we want to really just keep this in mind, that loneliness, if we consider it as that national epidemic, something that everybody's experiencing, the best treatment for that is connection. And so that really gets us to the more positive part of our talk of what do we do about that. So I'm laying out a whole lot of negative things to start. Here's the issue, here's the data, here's why we have to worry about this. And that's important in creating a sense of understanding of kind of why this matters so much. But it's not to say that there's not hope in how we manage it. So that prevention component that I mentioned, that connection, can make a huge difference for people in reducing the risk for some of those things. There's been a lot of research recently, especially, that while risk factors are really critical to recognize, the best remedy for having a lot of risk factors is having even more protective factors. And for people who have experienced, for example, a lot of trauma, especially early on in life, they've created this thing that's called an ACEs score for adverse childhood experiences. The higher that ACEs score is, the more at risk they are for both physical and psychiatric conditions throughout their lifespan. But research has recently shown for people who had really high ACEs scores, but also had really high scores of the number of protective factors they had, their impacts over their life were significantly less. So even for people who have experienced a number of negative things, if we can focus on increasing the number of positive things that happen to those corrective experiences, can positively impact the rest of their life. And that was a really critical change in mindset for folks, because sometimes it can feel like, oh, I had all these awful things happen to me, it's never gonna get better. When in reality, there's a lot of opportunity for things to shift just by creating some opportunity for some of these protective factors to happen. So the definition from SAMHSA, so that's one of the biggest mental health resources across the country. Protective factors, they're characteristics associated with a lower likelihood of negative outcomes or that reduce a risk factor's impact. So exactly like I said, if we have all these risk factors, but we add in some protective factors, that risk level goes down. So we need to think about that in terms of individual protective factors. So my self-worth, how I think about myself, my connection with myself, those are protective factors that don't involve anybody else. Protective factors in relationships, do I have positive personal connections with other individual people? People that make me feel safe, make me feel connected, accepted. In communities, so what are our communities? So this right here, this is our community. Our local county, the towns that you're a part of, again, the sources of faith that you might be connected with, other volunteer programs that you might be a part of, your senior services, etc. Those are all communities. When we have connection to those communities, that is an incredibly important protective factor. And then our society in general, so we're getting broader and broader here, but when we're part of a society that makes us feel connected and accepted, there's a lot of protection that comes with that. If I feel like I am safe in my environment, in not just my town, but just in the culture of the world I live in, it's a huge protective factor. The people who feel more at risk, that's where things can get a little slippery and where we might want to try to infuse some other protective factors in there. So other more specific examples of protective factors are also things like just access to basic needs. So my stress levels are really high because my anxiety is through the roof and I'm starting to feel depressed, and I just seek out treatment for that depression. But meanwhile, I'm also not really sure where my next meal is going to come from or if I'm going to have access to housing in a month. I can go through the best round of treatment in the world for my depression, but if all those other stressors are still in place, it's going to be really hard to start to feel better because those are realistic worries that I have. So we want to keep in mind that we need to be mindful of those things too, and trying to get connected to the right resources like, again, social services to get the supports we need in that realm. So thinking about the role of connection in a different way. So we have this social connection over here, and moving our way through that, what the benefits are of that connection. It creates a sense of resilience. So sometimes we'll think that, the times in life where I'm happiest is when everything's going perfectly. I'm not impacted by anything because nothing is going wrong. It doesn't tend to last all that long, right? Like there's always some sort of stress. Something is happening. But if I feel connected and I feel safe and I know when that bad things happen, I have my people that I can go to talk about it, to get help. I know how to overcome that obstacle, even if it's stressful. That creates a sense of confidence and resilience for me that I know I'll get through it. The hard stuff will always happen, but if I know I have the resources that I need to get through it, I'm gonna feel a little bit safer, a little bit more comfortable, and a little bit better. A general sense of well-being through social connection. So there's a lot of research out there, like I mentioned at the start, that there's actual physical and emotional impacts of connection in terms of diagnoses. We see a reduction in heart disease, we see a reduction in dementia, we see a reduction in anxiety and depression and more severe mental illnesses, a reduction in substance use when people have social connections. It's incredible when you think about it, that just having connections with other people, having relationships can impact our physical health, but it does. So keeping that in mind as we start to think about what aspects of health we consider and how we might treat those things. Obviously, there are a lot of different illnesses that do require medical intervention, but when we are surrounded by that support group, it can really positively impact our treatment plans. Again, that sense of safety is really critical, and the more wrapped up we feel by our friends and family, for example, the better we're going to be overall. And then again, the research shows that for people who have a strong sense of social connection and a reduction in loneliness and isolation, have a longer lifespan. So all of these things are really leading into that, but the data shows rather concretely that the average length of life for somebody who has a sense of social connection is actually significantly longer. So I've said this a few times now, but connection as a form of prevention is really the focus here. So we can't prevent all the bad things from happening all the time, but if we have a pretty solid foundation for how to navigate them when we need to, we can come out in a bit of a better spot. So what does that look like? So strengthening and maintaining the connections we have. So taking a bit of an inventory of what things are already available to you and strengthening those. So maintaining current connections. Like I mentioned, they may start to feel or look a little bit different in how we do that. Maybe you used to see this person every day in person because you worked together, but now you make an intentional habit to pick up the phone at least once a week and call them. Or you go out to dinner, go out to lunch, whatever that may be. Engaging in online social activities. So this is a funny one for a lot of people, especially when you're coming from a generation where the internet was nowhere near what it is today. But there's so many opportunities for social connection online where maybe it's not an option for you as easily anymore to go out and physically see people. But now all you have to do is jump on, if you have an iPhone, FaceTime, and you can see people, you can still engage with them. It's gonna feel different, but it's a different form of that connection that you can access a little bit more easily. This can become a really critical one, for example, when folks maybe have to stop driving or are homebound for a certain reason because of a medical condition. They can start to feel really isolated. They don't want to feel like a burden and asking people to come over all the time, although there's certainly many people who will, and it's important to ask. But our access options have gotten significantly larger through the concept of being able to use video platforms, being able to connect with people online in a bit of a different way. Volunteering is another big one for folks. So I'll kind of stick with that concept of retirement. Our jobs tend to give us a lot of purpose. When we retire and we move away from that, finding different sense of purposes can be really helpful, and volunteering is a great way to do that. It makes us feel good. We're helping others, we're connecting with people, we feel like we have a sense of purpose in life through those sorts of things. Volunteering can be a great way to do that. Caring for a pet is another big one. So even just being out here today, we have a book on the table that it's about Gizmo, who's a local therapy prevention dog in the state of Connecticut. And it's a book for kids. But right on the cover is a picture of him, just a dog, and the title of the book. And probably in the half an hour before I came in here to talk, I've had at least 5 people come up to me this morning and say, oh, if everybody just had one of those, we wouldn't have a mental illness problem. I don't know if I would go that far, but it certainly helps. That sense of connection and taking care of somebody else or something else like a dog or a cat has huge impacts, again, on our sense of connectedness, and responsibility for other people or animals can have a huge impact. Yeah. The pets themselves can be a fantastic resource. I did my whole dissertation actually on animal-assisted therapy programs and the connection with animals. It's a huge resource for me. Establishing a daily social routine. So we have a lot of routines in our life. We get up, we take a shower, we eat breakfast, we brush our teeth, but incorporating some social connection into that plan too. So like I said, maybe once a week you make your rounds with your phone calls. You go out to lunch every Tuesday with this group of friends so that you can still see each other. Doing things like that to just fill that cup without having to kind of think about it quite as much because it becomes a habit for you. Finding grief support. It's another really big one. So whether that is because you've lost another individual who was really important to you, or again, grieving different parts of your life. Grief happens in a lot of different ways, but creating opportunities to have that connection with other people who have been through what you've been through. That connection and validation of similar experiences can be so important for folks. Connecting with a treatment provider. So again, if we get to the point that we're struggling and we really need some additional help, being able to do that, and we'll talk more about that in a minute. Exploring what brings you joy. So again, what fills that cup for you? What makes you smile? What do you look forward to? Having that list available to you so that when you're starting to feel a little down, you have your resources. You know what to do. When I'm having a really hard day, I'm gonna go home and I'm gonna go hang out with my cat. I'm gonna make sure I pick up my phone and I call that friend of mine. I'm gonna go out and take a walk because I know that fresh air really does me some good. Having that list of things, but also noticing if that list is starting to dwindle a little bit, trying new things. What might I like to do? What have I never had time for before, but maybe I do now and I can try something different? Never too old to learn new things and try different things to see if maybe that might be one of those things that now brings you joy. So allyship, connection, again, it's all about connection with other people. Maybe you're not the one struggling, but you notice somebody else is. How do you be an ally for them? How do you ask those questions to check in on them, make sure they're doing okay? Like I just said, validating experiences is a huge way to form connection. Yeah, I get that. I've been through that too. I know how hard that is. Fortunately, every single person, no matter what stage of life we're at, we're all aging. Every single person. We're all going through that together. We're at different stages of it, perhaps. But everybody's going through that. That's usually a point of connection for people. Illnesses can be another one. Support groups for folks who are experiencing a similar illness can be another one. Grief support groups. So again, there's some more formal mechanisms for that. But just joining in those experiences can have a really meaningful impact. Thinking about it again through what to do if you're maybe not the one struggling, but you notice that somebody else is. You're getting a little worried about them. How do you ask that question? I do another whole training for folks specifically about asking that hard question that is specifically related to suicide prevention, because folks have a really hard time getting the words out of their mouths. So we physically practice in the room. If you've ever had thoughts of wanting to harm yourself. This is a similar concept. Asking somebody, are you feeling lonely recently? I've noticed you're starting to pull away a little bit. I just want to let you know I'm here for you. If you need anything, I would love to connect. Maybe we should schedule another time to get together sometime soon. I could really use that connection too. I've been feeling a little more isolated. So I'm validating, I'm asking, I'm putting the question out there. Have you been feeling a little more down recently? I'm just noticing some differences. I want to make sure you're okay. Giving people the permission to say, yeah, I have been, actually. Thank you for noticing. I could use some help. Sometimes people aren't going to volunteer that information unless we directly ask them. So it's important that we can create that opportunity for them and we feel comfortable to do that. Recognizing the warning signs as well. So again, somebody might not volunteer that information and maybe they're not open to that conversation, but what things have you been noticing? Maybe they were calling you every week for a while, but suddenly those calls have stopped coming. They usually attend a weekly gathering where they go to church every Sunday and suddenly they're not anymore. Those are some warning signs that maybe something's happened. Being able to check in with them at that point to say, just remind you, I'm here, I do care. I'm just checking in on you. And offering that support where it's needed, knowing where to send them for that help can be a really critical next step. So asking that question is by no means saying, I'm gonna be the one to fix it for you, but I can certainly be there to help you as we figure it out together. So again, that sense of connection and togetherness, even when things get really hard. So creating some local resource lists. Recommend this to every client, every patient, and all of my staff all the time, regardless of what the topic is. Know what your resources are when you're not struggling. The last thing you want to put yourself in a situation for is, I'm in a really hard spot, I'm feeling really lonely, I'm feeling really down. Now I have to figure out how to get that help I know I need, but I don't know where to go. Have that list prepared. Know what your resources are so that when and if that happens, you know where to go. That's the whole point behind prevention. Getting that education, knowing your resources, so if you need them, you know where to go. So every table out there has a number of different resources and connection points available for you. Go collect a handful of them. Maybe it's not even something that's relevant to you, but the next time you're talking to your friend and they bring something up, you can be like, oh, I went to this thing. I went to this table, I had this great conversation with this person. I think that could be really helpful for you. Knowing what those resources are and asking the people the questions is gonna help get you there. So some examples of that, senior centers are a huge one, social services often are embedded within that. Knowing what those local connections are for you, usually right within your town, can be a great starting point. From there, thinking about other aspects, we talked a little bit about technology. Technology is really overwhelming, it's changing every single day. Knowing what some resources are to also learn more about that, to embrace it differently. So one example of that, UR Community Cares Tech Center in Manchester has classes, individually or in groups, to help teach you how to use different forms of technology. Apple, for example, if you go into an Apple store and you buy a new iPhone, you can go to a class and they'll teach you how to use it, all the different ways to use it. There's videos online, but having an in-person conversation might be easier. Lots of resources for that. Physical activity is another big one. So again, like I mentioned, we start to slow down a little bit as we get older. It might be harder to do things, but there's different walking groups in a lot of different towns in the area. Connecticut's beautiful, especially this time of year, to take some walks, get outside, get some fresh air. There's groups specifically for seniors that make sure that those trails that you're accessing or the roads you're taking are safe and a little easier to navigate. Silver Sneakers is another great program that's available to get some of that physical activity, and I've heard a few folks mention, for example, Bolton, the town hall, the senior center does chair yoga. Another good example of that, keeping our bodies moving can be critical. Then the last resource, it's a little bit more of a broad one, is 211. So they have a website too. You can also call 211 for many, many, many different resources. But their website, you can actually put in your town and it'll give you a list of all these different sorts of resources, whether that's wellness programs, recreational activities, daycare, all sorts of different things are on there. But specifically for the population we're talking about today, there's many different things available on there to create some opportunities for connection. So it's worth checking out. So knowing the warning signs, like I mentioned earlier, recognizing it when things might be a little bit more challenging. So being able to just ask a couple questions. Lots of different questionnaires out there. When you go to the doctor, you get asked all sorts of different questions, right? This one's really simple to just keep in your back pocket. So just 3 questions. On a scale from 1 to 3, 1 being hardly at all, 3 to being all the time, rate the following. How often do you feel that you lack companionship? Number 2, how often do you feel left out? Number 3, how often do you feel isolated from others? The higher your score on those 3 questions, the higher there's an indication of loneliness. So most people, it's pretty average to vacillate depending on the day, but somewhere between a 1 to 5. Some worry as that number gets higher, but not too concerning. When we start to get into the 6s, the 7s, 8s, 9s, that's when it may be a good time to be like, maybe I should talk with somebody about that. Maybe I should try to build up some more of that connection, get out later this week, go down and check something out, or seek some help where it's needed if it's a more formal treatment. Might be needed in those situations where it's feeling a little bit more pervasive. So maybe if every few days we start to see that number go up, or we're consistently scoring at a 7 or an 8 or a 9, it's a good indication to just ask somebody for some help. So then lastly, how to get that help, when to get it, what it looks like. So consistent feelings of loneliness or isolation, lack of motivation or energy, persistent low mood, sadness, other sorts of mood changes, feeling really on edge. For some people, that's really irritable. People don't recognize that a lot of times anger and irritability is a symptom of something else. It's an easy emotion for us to feel a lot of the time, and it often helps us deflect from what's going on underneath it. Usually it's feelings of sadness, anxiety, other things that are happening, but anger is usually a little bit easier for folks to express. Thoughts of not wanting to wake up, wishing you were dead, so like I mentioned earlier, can be a really sensitive subject for people, but we have to think about it, we have to ask these questions. Making sure that people know, I'm here, and you can hear it. If you're struggling, I want to know so I can help you. And then lastly, any other sorts of shifts. So can never create a slide that's going to have every single list of symptoms of what you might experience, but you know yourself best. Your family and friends that you surround yourself with know you the best. They notice changes of any kind, of like, well, this isn't normal for you. Something seems off. It doesn't matter in what way, but that might be a time to just pause and ask, hey, what's going on? Are you okay? Maybe we should talk to somebody. So then lastly, just knowing what your local support network is. There's lots of different programs. I started at the beginning naming off a few. Talking with your primary care doctor can be a great start. Medical professional, you got a good relationship with them, I hope. There's somebody you connect with. Just mentioning it to them, they should be screening at most of your appointments, especially your annual physical. It's required now that they ask questions around depression and anxiety. But they could be a good one to just raise that question of, I don't know, I've just been feeling a little different lately, having a harder time connecting with people. You know a lot of resources in your area. Your social services team, if I haven't driven that point home recently, is an important one. So they're present in every town, knowing where they are and how to find them. I mentioned I work for Hartford Healthcare. We have this really great free resource called the Center for Healthy Aging. They're here today. I think they're in the gym. They're an incredible, incredible resource. Again, completely free, doesn't require any money, doesn't go through insurance, just has a number of different resources in all aspects of any resource you could possibly need around the Center for Healthy Aging. So whether that's physical or emotional services, they can provide you a lot of different resources. Also another agency here today is CHR, Community Health Resources. They're in Manchester. Like I mentioned, I work for Natchaug. We actually have a specific intensive outpatient program just for older adults. So again, getting that validation from people who are experiencing similar things is really critical. So we have groups specifically for a population so that when they come into our program, we make sure they're with other people who have similar experiences so they can get that connection. The Institute of Living in Hartford has a similar program. Psychology Today is a great website to find local individual therapists. So if group's not really your thing, but a one-on-one therapist would be better, you can certainly find a lengthy list there. I mentioned 211's website. They can be great to find, recreational resources, wellness programs, etc. Dialing 211 also gives you access to mobile crisis services. So in the state of Connecticut, there's a few different avenues for seeking support. 211 is one of them. So non-emergent, it's not an immediate safety situation, but you need some help. 211 can help with that. They have global crisis supports, they have housing supports, a number of other things. The website's great in learning more about that, but you can also call them. 988 is the Suicide and Crisis Lifeline. So this is only a few years old. They just recently celebrated a birthday for that line. Really designed to be exactly what it describes. It's a hotline, crisis line for anybody who is experiencing thoughts of suicide and needing to connect with somebody. And then 911, as we all know, is for emergencies. So we're really pivoting to having these 3-digit lines, so it's really easy to remember how to call when you need it. So 211, 988, 911. You can call any of them. Even if you're not sure if it's the right one, call one. If it's not the right one, they'll get you where you need to go. But knowing what those numbers are, we have our table in the back, the Bulletin Prevention Council, it's a purple tablecloth, come find us. We have a little cheat sheet card right on our table that has all 3 of those numbers on it if you need it. I think it's a magnet. So again, not an exhaustive list, but some of the more local resources that are available to you. We do also have some handouts at our table, just to plug for a second. We've got pages of a whole list of different treatment options in the area, specifically for adults who may need treatment in this realm. We also have a second handout that's specifically for family members who might just need support in helping somebody else navigate that system. Being a caregiver, again, has some unique situations to it, and it doesn't come without its own levels of stress. So we want to make sure we're taking care of our caregivers too. So there's some resources there for that. So then just lastly, the key takeaways, what I'd really like you to take home today from this talk, hopefully, is that there's always resources available. There's a number of them. We have many, many, many within our county. If you don't know all of them, that's okay. But just know where to find them. Know how to ask for that help when you need it. And don't be afraid to reach out. It's not something that anybody has to navigate alone. Again, we know the loneliness and a lack of connection has a number of negative impacts that we just spent the last 45 minutes talking about. But the best way that we can overcome that is through connection, through saying, hey, I need help. So never be afraid to ask for that, whether it's for yourself or for somebody else, and connect with each other. There's a lot of different opportunities for that today, so please take advantage of them. And lastly, just thank you for having me. I hope this was helpful to you. If you have any questions, I'm happy to stick around for a little bit. And otherwise, I think the next talk starts in about 4 or 5 minutes. So thank you.